Next up, we have Brian Magierski speaking. Brian is the founder of Cerebrum DAO, super active member of the DeSci space. And right before he came to DeSci Berlin, he was actually, in fact, meeting with two researchers that Cerebrum DAO had helped fund and kicking off their project Transfidelity, which is going to look at longevity and brain health. So yeah, welcome to the stage, Brian.
Hey, everybody. So DeSci Berlin is becoming like a milestone point for Cerebrum DAO, so like a checkpoint to see how we've been doing. And so I'm going to give a little bit of a retrospective to see what we've developed over the past 2 years. I remember back at DeSci Berlin 2023, I believe, we were just getting started. So it's been an interesting journey, and then I really want to talk about the road ahead, because I feel like with how do I move this? Do you know how I move this forward? Clicker. Okay, cool. Let's click it. Awesome. Okay, cool. With DeSci Berlin, I feel like, and with DeSci in general, we're constantly just proving ourselves. And so we go from one proof point to the next proof point to the next proof point. And it's really remarkable how fast things have developed even over the short period of 2 years. So Cerebrum DAO, yes, we're envisioning a world without brain diseases. So we're targeting and seeking to end all brain diseases for everybody. So all of your brains in the audience here can hopefully thank us one day. We've been on quite a journey. So 2023 DeSci Berlin, we were doing community activation. Just like, let's see if we can get people to follow us. And one of our core team members, Yatan, he runs operations. I met him at this conference in 2023. He has a family member that's dealing with a brain illness, and this meant something to him, and now he's an active part of doing something about it, which is absolutely fantastic. A year later, if you fast forward, we launched our token, the Neuron token, on the Bio Launchpad. We raised $2 million in total through private pre-sales as well as the live auction. In order to kind of build confidence, we had to attract top-tier neuroscientists and drug developers to actually show that our community is probably going to get something done if we raise the money. And so we were able to do that and really pull in people from outside of DeSci in the dozens with real deep expertise. Next, we had to prove, can we actually build a pipeline of interesting projects and opportunities that otherwise would not get funded, and have promise for becoming actual therapeutics for humans like us. So we were successful. We filtered through 150 plus projects. We identified 3 that we wanted to invest. We invested in the IP. We successfully outsourced some of that IP from top tier universities, and we minted 3 IP NFTs over that period. And then we had to prove, could we actually take these projects and manage them effectively and move things forward and achieve some proof points. And out of those 3 projects, we've advanced 2 past their first milestone. We did follow-on financing through Molecule's platform for an IP token. We raised $450,000 of additional capital into 2 projects. And those projects are well underway, and one of those is actually going into first-in-human trials very shortly, like within weeks. We just submitted last 3 weeks ago to the IRB, so we're expecting to start those trials within the next 3-4 weeks. And we just minted our 4th IP NFT as well. I'll talk about that in a second. So here's our portfolio really quickly. Percepta is the one that's going into human trials. Fission, we hit our first milestone. We did in silico screening of billions of compounds, did AI optimization on it. We've identified 50 molecules targeting mitochondrial dysfunction. Those are now being synthesized and going into the next phase of work there. So really fantastic progress. And we did kick off Transfidelity at the University of Basel yesterday, or 2 days ago, sorry. We minted this yesterday. I did it right here at DeSci Berlin. It's a project that took 1.5 years. We out-licensed it with 3 university tech transfer offices. Actually crazy. It was the first project I identified when we got started, and it took the longest, but we got it done. And it's really promising. It's based on a therapeutic that did make its way into phase 2 trials. So we're incredibly hopeful on the safety profile of this. And the researchers have patentable IP that made it 100 times more effective. And we've invested in a couple equity companies. These are platform companies. going into clinic or in clinic around the amyloid hypothesis. Big dollars, not something we can play in, but we wanted to have a role and a seat at the table. So that's tremendous. That's all happened in 2 years, which is really mind-blowing, because my thought with DeSci was, is anybody going to care? Is anybody going to come? And are we going to find anything interesting to fund? And can we attract the talent that can actually do the work that we need to do? And it's been really inspiring, because even when you look at the neuroscientists and the drug developers, with deep experience, with decades of experience in pharma and biotech, they're actually really excited and almost giddy about what they can do, because a lot of what we're allowing them to do and experiment on were things that they were restricted from doing in industry, just because of conservative nature. They're like, these are experiments we wanted to run, these are things we wanted to try, but we were never allowed the budget to actually do it, and so now they're getting to do it with us, and we're seeing tremendous progress. The next thing I think we need to achieve as DeSci, and at least is how Cerebrum DAO is thinking about it, is we've attracted like dozens of people from industry, from outside of Web3 into Web3, and they're actively working with us. My question is, how can we attract the millions to hundreds of millions of people that are affected by these diseases, the patients themselves, and activate them in our community so that they're participating? They're participating in the research, they're sharing their data, they're owning our tokens, they're funding our projects. And I think this is going to be a real breakthrough if we can solve this. And I think the way you do this is not expect them to come to you. You need to go deep into the communities where they live today and speak to them about something that's critically important to them, and show them something that's different, that is going to engage them and pull them in. The challenge for us, though, is we're ending brain diseases, and brain disease is a massive market. And so if you look at it across neurodegenerative disease, neurovascular, psychiatric disorders, brain tumors, et cetera, where do you start? Like, what patient community do you go talk to? How do you get them interested? You can't just say, we're going to end brain disease and get people excited about participating actively. And so it's close to half the population that's affected by these diseases right now. So it's a rich target market, but what's the message? What's the call to action? And so we drilled down and we said, okay, let's go look deeper into this and say, well, let's not look at brain diseases. What if we looked at neurodegenerative diseases? Well, each of these, there are many of these, and each of these has many of different types and communities. And so let's look at Alzheimer's. And we call Alzheimer's disease, but it's not a single disease. It's many diseases with many different profiles. And so you can look at it, everything from high risk, not determinative, like sporadic APOE4. Familial Alzheimer's is determinative. If you have these mutations, you will get Alzheimer's today, unfortunately, because we don't have therapeutics yet. And then other types as well. So now we need to go even deeper. And let's hit familial. So you got 3 mutations here, the presenilin 1 and 2, and the amyloid precursor protein. And you can't even just look at familial Alzheimer's, you need to drill even deeper than that. And when you drill into amyloid precursor, you find out that there's some various mutations around the world that we know about. And these are only because the data is in certain Western markets. I'm sure it's much more prevalent than we think. And then you have trisomy 21 overexpression. So if you've heard my pitches before, I have a daughter with Down syndrome. Trisomy 21 is the technical term for Down syndrome. They have a triplicated 21st chromosome, amyloid precursor proteins on the 21st chromosome. It's overexpressed. It produces amyloid, and other biology in people with Down syndrome causes Alzheimer's early in life. So that's the opportunity. So now we've drilled all the way down, and what do we find? We find the Down syndrome community. And what is the Down syndrome community? It's 6 million people globally that have the condition. But when you look at family members and caregivers, you look at a number that's more like 24, 36, 40 million people that are affected, that care about solving this problem. What's happened with this population? Well, they're the largest population that are having Alzheimer's, and they're on a pathway to get Alzheimer's. But they've also been largely underserved by Alzheimer's research. And so it's a community that's starving for solutions to Alzheimer's and is completely underserved. And so one example of that is we do have FDA-approved therapeutics for Alzheimer's disease. They were approved in 2021, the first one. People with Down syndrome weren't allowed to even get prescribed the therapeutic until 2024 when the federal government intervened and demanded it, because they've been chronically excluded from clinical trials. And so you got a population of people that is on a pathway to Alzheimer's disease, and you're not even studying them in clinical trials. So there are a lot of organizations we can go to, and these are only some of them. There are many more. I missed a lot. We've had tremendous response from clinicians that serve adults with Down syndrome, from clinicians that serve programs of people of all ages with Down syndrome, and researchers who have been focusing on this. And so there's an active community, and it's really interesting. Just like the Down syndrome community has been underserved and eager to find participation, the researchers and clinicians also are. And so we've been warmly welcomed into organizations already to present and included in some newsletters that target researchers and clinicians with Down syndrome. So it's been fantastic reception so far. But it's great. We can go talk to these communities and say, hey, we're Cerebrum DAO, we're ending brain diseases, we want to do something with you. That's not necessarily even inspiring enough to get them activated and using our token and sharing and participating. So what do we need to do next? We need a compelling project. We need some call to action that says, if I join, I can participate and I see progress being made toward a solution. So this is a pre-announcement. We're not closed yet. We're still, I'm putting my ass on the line to get this deal done right now, but it's an important one. So we found an amazing researcher, thanks to Molecule and Logan. Huge call out to them for sourcing this opportunity. It's a full cell line brain organoid model that's been developed by a wickedly smart researcher at MIT, who now is setting up her own lab at Harvard and Mass General. And so we're going to do a collaboration between MIT, Harvard, and Mass General. We're going to develop a brain organoid model, full cell line for Down syndrome. And we're going to create amyloid pathology, and we're going to go on a hunt for therapeutics and therapeutic targets with this. And so this is our next big project, and we're going to use this project as a call to action to bring in a patient community. So we want to see our community now, Cerebrum, which is 5,000-6,000 followers on social media, a couple thousand in our Discord server, and really couple hundred active. We want to see millions of people come in, and it's going to come from the patient community, and we're going to make it easy for them. No private keys, just you can get into our ecosystem, you can buy our token, you can fund a project, but then more importantly, you can participate in the research, share data, and earn tokens as well. And show a lot of love to this community and hopefully create a pathway to solving Alzheimer's, not only for them, but the broad population as well, based on what we can learn from this project and this community. So if you have a brain and are interested in us, come and join the Renaissance. Our Discord's right there. You can follow us on X as well. A lot of our project updates get streamed from there. And we're also now integrated to the Molecule platform, so our research updates are going to get streamed directly into the Molecule platform as well. So thank you very much, and look forward to talking to anybody.